Hey guys, it's Dr. Diaz again with Momentum Chiropractic and Rehab. We have Diana here. She's come to us. She has a little bit of a shoulder issue that we've addressed already with some therapies. With some examination, we have when we're putting the shoulder into an internal rotation, stretching the posterior muscles, we're having some irritation. She injured herself doing some dips at the gym, kind of heard a pop in there, so we did a little bit, like I said, we checked supraspinatus, we checked all the rotator cuff muscles, and we were kind of pointing here towards the teres minor, or the posterior shoulder muscles. So upon palpation, it's very tight. We have some, like I said, some action that's causing a little bit of tenderness within the muscle. So we've done already, we've done some electronic stimulation just to kind of loosen the muscle up, get a good micro massage within there. We've used some hot packs to warm up, get some increased circulation on the muscle. I already explained that we're going to need a series of therapy to try to relieve that muscle. At this point during a palpatory examination and orthopedic examination, we're seeing that there's an injury within that muscle. Our options of care are going to be a series of treatment to try to relieve or try to heal a sprain strain within that area. If we don't have any relief, then at that point we might have to move towards imaging. Possibly the best way to see an injured or torn muscle would be an MRI. Now my initial clinical assessment doesn't point me to an MRI immediately, because I don't think there's a complete tear. We've done exams before where we've had to send for imaging and there have been a complete tear, but the high percentage of it not being a tear, the better, in my opinion, the better recommendation is a series of care, and then from there we can determine what needs to be done, if there's imaging at that point needed, okay? So what we're gonna do today is we're gonna actually perform a little bit of a cervical adjustment, thoracic adjustments, lumbar adjustments, and right after the adjustments we're gonna do some active release technique on that trigger point or on that muscle here. Okay, so vamos a hacer unos ajustes quiroprácticos, okay? So let's have you stand right over here for me, okay? Y usted, si puede, nomás hágase un poquito más para enfrente en la silla. Right there, y luego recárguese aquí para atrás. Okay, I'm going to go ahead and communicate, guys, bilingually. Speaking to the audience in English or Spanish if you want to hear it in Spanish as well. But to her, I'm going to speak to her in Spanish. Okay, vamos a ajustar aquí por el cuello. Very good, okay, very good. So guys, as you're watching me as I'm talking, I am definitely palpating within the cervical spine, and I could feel the restriction right here at C2. Relájese aquí. Muy bien, okay. Acuéstese aquí boca abajo. All right, I can definitely feel the restriction as I'm doing a palpation and feeling the cervical movement. So puede acostarse aquí boca abajo. All right, very good. Vamos a ver aquí arriba. ¿Cómo se sintió? Bien? Poquito dolorcito? Yep, okay. Very good. So definitely a little bit of pain here in the neck. Now, mind you, if we're dealing with this injury that's been going on for almost a year now, I'm absolutely looking for discomfort and into the cervical region as well. Aquí lo siente también? Okay. Aquí no tanto o igual? Igual? Okay, very good. Respire hacia adentro. Saca el aire completamente. Good, okay. Voy a aplicar una pomadita aquí, okay? I'm going to use a little bit of lotion here just to loosen up some of that soft tissue that we just adjusted through in that mid-thoracic or that upper thoracic region here. Good. So we got some trigger points here that are accelerated or that we feel a little aggravated here. Dolorcito en estos músculos, so a little bit of pain in these muscles here. Okay. ¿Poco dolor ahí?
Sí.
¿O bastante?
Duele bastante.
Yeah, I'm sorry. So we've got a lot of pain in these muscles here. Okay. Relájese aquí. Okay. Relaja el cuello. Good. Okay. Relájese aquí. Okay. Respire hacia adentro. Saca el aire completamente. Very good. Okay. Acuéstese de lado mirando hacia este lado. Para acá, acostada de lado. Y aquí la pierna de arriba doblada, el de abajo manténgalo recto. Okay. Hacia acá, aquí. Este brazo para acá. Ya en centro relaja la cabeza. Okay. Respire hacia adentro. Saca el aire completamente. Good. Muy bien. Acuéstese mirando hacia el otro lado. All right. Okay. We're going to adjust through the lumbar spine. We did one side first. We're going to get some movement here through the sacrum. Respire hacia adentro. Saca el aire completamente. Good. Muy bien. Acuéstese boca arriba. Mirando hacia el cielo. Okay. Extiende los pies para acá. We're going to get a little bit of ankle adjustments. Now she does have a knee injury, so we're going to be gentle through that knee here. Relax here. Good. Okay. Sorry. Get movement in here. Good. Okay. Very good. All right. Vamos a ayudar a sentarla aquí. Okay. Y puede sentarse mirando hacia este lado. All right, guys. We're going to perform a little bit of release techniques onto this shoulder. So probably a better angle is going to be right over here. Right there, and then you'll be able to see this happening here, okay? All right, so vamos a empezar. Este brazo lo va a tener primero así, okay? Y lo va a llevar hacia este lado, okay? En este brazo, okay? Ready? Extiende el brazo hacia el lado y dele para enfrente. Okay, good. Para atrás hacia. Good. Okay. Dele hacia enfrente. Muy bien, para atrás. Ok. Dale hacia enfrente. Hacia atrás. Good. Dale hacia enfrente. Y hacia atrás. ¿Lo siente? Ok, good. Relax right here. Ahora con este vamos a enseñarle. Va a doblar así. Y esta vez lo va a llevar hacia arriba. Ok. Very good. You can stay on the opposite side. We're just showing her on this side how she's going to perform the movement. Levante el brazo así. Dele hacia arriba. Para atrás hacia abajo. Dele hacia arriba. Para atrás hacia abajo. Okay. Hacia arriba. Para atrás hacia abajo. Hacia arriba. Dale, 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 dale. You got it. Para atrás hacia abajo. Y dale hacia arriba. Para atrás hacia abajo. Okay. Okay, esta vez vamos a empezar así. Y vamos a llevarlo así para acá. Okay. Start right there. Stay right there. You can turn right here, okay, dale, para atrás contra mí, contra mí, dale para atrás, contra mí, good, you got it, there, para atrás, para frente. So, hay más dolor cuando usted hace así, ya, o así, hacia arriba, siente el dolorcito por ahí adentro, okay, there, dele para enfrente, okay, good, para atrás, good, okay, go, okay, good, forward, otra vez, and then forward, okay, good. Okay, let's see here. Levanta el brazo así. Okay, no me deje que empuje para abajo. Dolor con eso.
Sí.
Yeah, dolor por aquí. Right in here. Okay, so go ahead and like this y dale para arriba. Dolor con eso. Okay, good. Okay. All right, muy bien. So definitely we are dealing with a little bit of a rotator cuff injury. Series of care, series of treatment would be what would be recommended for this muscle here. What we'll do is we'll do a follow-up video possibly like in a week, see how she improved, see how the movement's going with the muscle. We'll go from there. All right. ¿Algunas preguntas? ¿Todo bien? Very good. Thank you.